Hello, Medicare Advantage Risk Adjustment Operators, Innovators, and Learners. Welcome to another learning video of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. If today is your first time joining us, we want to say thank you. If you have been a seasoned learner with us, we want to also say thank you for your time and learning with us. If you have not subscribed to our channel, I will greatly encourage you to subscribe to our channel so that you do not miss anything from us. I am your host tutor, Dr. Prince Bewa. This month, our theme is on special needs plans, Medicare Advantage special needs plans. And last week, we had an introductory lesson on what are SNPs, special needs plans. So if you are joining us for the first time, I will encourage you to watch last week's video, which will be linked to this video's notes, and you can pick up from this section because we are building up from there. So let's jump into today's. Today we'll be focusing on the C-SNPs, and we covered a bit of it as part of the introduction last week, which are chronic condition special needs plans. We'll be looking a little deeper into C-SNPs specifically today. One may ask, what are C-SNPs? C-SNPs are special needs plans that restrict the enrollment to individuals with specific severe or disabling chronic conditions. These plans go beyond the basic Medicare Part A and B services by providing specialized care, coordination for beneficiaries with complex needs. This plan is specifically reserved for beneficiaries with complex chronic conditions. And the reason why C-SNPs are needed is that approximately 2/3 of all Medicare enrollees have multiple chronic conditions, requiring coordination among the primary care providers, the specialists, the inpatient, outpatient facilities, and all the extensive ancillary services are truly needed to provide high quality care for these type of beneficiaries who have multiple chronic conditions. And that is the goal of the C-SNP. Some of the chronic conditions that makes one eligible for enrollment into C-SNPs include chronic alcohol and other drug dependence, autoimmune disorders, rheumatoid arthritis, lupus, and others, cancer, cardiovascular disorders and chronic heart failures, dementia, neurological disorders, and diabetes, end-stage renal disease, ESRD, severe hematologic disorders, HIV/AIDS, chronic lung disorders, and chronic and disabling mental health conditions. These are all some of the chronic conditions that makes one eligible to be able to select C-SNPs. And even for plans that are offering the C-SNPs, these are some of the conditions that members will have. If you're working in Medicare Advantage risk adjustment and you are doing risk adjustment calculations for a C-SNP, then definitely you are bound to be seeing some of these conditions and their corresponding HCCs in your data. Otherwise, there's something going on in your data that then reflect into your risk score. How has SNPs grown over the years, and specifically for the C-SNPs? What you see from this chart, which is coming in from mimilabs.ai and also leveraging the MimiBot. If you have not heard MimiLabs before or used the MimiBot, I will encourage you. It's for free. You can go to the website and play around with it. Getting onto C-SNPs, and this data is leveraging the CMS landscape data over the years. You can see from this chart here that the number of chronic condition SNPs, special needs plans, have dramatically increased over the years. You can see here from 2018 through 2026, the number of SNP plans have increased tremendously, and especially you can see the steep slope that you can see from here. Even if we go into the number of plans versus the number of contracts, you can see that the number of contracts have increased, but the number of plans have tremendously increased, telling us that there are more contracts that are offering much more plans within each of the contracts. That shows also the need in the Medicare population in terms of what the plans are offering for C-SNPs. I hope this is helpful as you familiarize yourself with C-SNPs and their growth and what they are. Before I end, I want to encourage you, if you are not on our email list yet, go to our website, www.thehillsacademy.com/risk adjustment made easy, and you get on our email list and you'll not miss anything from us. And you also get free copy of From Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data source that compares the various data sources for you for free. Thank you so much for joining us. Otherwise, we'll catch you next week as we pick up on the next study on SNPs. Bye for now.